chronic kidney disease. That used to be called chronic renal failure. Now we call it chronic kidney disease. And as I said, chronic kidney disease or chronic renal failure, deterioration of the glomerular filtration rate over long time. And this can occur due to causes in the kidney or systemic diseases. And the two most common systemic diseases that lead to chronic kidney disease are diabetes and hypertension. So chronic kidney disease is a progressive loss of kidney function associated with systemic diseases as hypertension and diabetes, or kidney diseases like chronic glomerulonephritis, chronic pyelonephritis, obstructive uropathies, vascular disorders. And here we're going to have glomerular filtration rate less than 60 mL per minute, and for 3 months or more, irrespective of the cause. And chronic kidney disease can pass into 5 stages, from the normal kidney function to the end stage kidney condition, based on the deterioration of the kidney function, based on the decrease in GFR. So this table summarizes to us the stages of chronic kidney disease. Stage 1 of the kidney, this is the normal kidney. The normal kidney will always have a 3-digit GFR figure, usually higher than 100. But nephrologists just are satisfied with GFR more than 90. So if your GFR is more than 90, you have no problem, you have normal kidney, that's stage 1. Stage 2, or what we call mild kidney damage, is when your GFR drops less than 90, but it's somewhere between 60 and 90. And this is the earliest phase of chronic kidney disease, and the earliest sign that we can detect during this stage is microalbuminuria. Very minimal traces of albumin in urine. And the BUN to creatinine may start to increase late in this stage. In stage 3, this is moderate kidney damage. The GFR is between 30 and 60. Here you get more elevation of BUN and creatinine, and you start getting anemia. In stage 4, severe kidney disease, the GFR is between 15 and 30. That's very low, and here you will get the manifestations of chronic kidney disease that will probably need dialysis, like metabolic acidosis, hyperkalemia, salt and water retention, and the BUN and creatinine will keep increasing. Finally, we get to the end stage kidney disease, stage 5. That's the terminal stage of the kidney, where the glomerular filtration rate is less than 15. This is uremia. Your body function will be greatly impaired because of this. Here you have to be waiting for some sort of renal transplantation, or you're going to be dependent on dialysis for the rest of life. The manifestations of chronic kidney disease will affect literally each and every part of your body. But let me focus on 2 problems, anemia and hypocalcemia. Why chronic kidney disease patients, all of them, are anemic? Well, the kidney secretes a hormone called erythropoietin, and as the name implies, erythropoietin, it potentiates the bone marrow to produce erythrocytes, red blood cells. If your kidney is not functioning, you won't have erythropoietin, and your bone marrow is not going to be stimulated to produce red blood cells. Your red blood cells will drop, and this is anemia. So what's the hypocalcemia? What's the cause of hypocalcemia? Why do chronic kidney disease patients get easily fractured? Because they have less calcium in their bones. Why? Because they cannot make use of calcium. They cannot absorb calcium. They cannot deposit calcium in bones. Why? What is an important vitamin in the calcium metabolism in the body? It is vitamin D. How do we get vitamin D? Well, it's synthesized by the effect of sun rays on your skin, and this vitamin D that we develop, that we make under our skin, has to be activated first in the liver and then finally in the kidneys. Without the kidney activation, your vitamin D is useless. Here we have chronic kidney disease. Your kidney cannot activate vitamin D. You cannot absorb calcium from your gut when you don't have an active vitamin D. You cannot deposit calcium in your bones when you don't have active vitamin D, and this is the cause of hypocalcemia in chronic kidney disease. When are we gonna dialyze our patients with chronic kidney disease or chronic renal failure? Simply remember your vowels. A, E, I, O, U. These are the indications of dialysis. A, Acidemia, whenever the pH is low, severe acidosis, this is an indication for dialysis. E, electrolyte imbalance that leads to AKG changes. I'm talking about hyperkalemia. Hyperkalemia that causes tall peak T wave. This is an indication for dialysis. I is actually a non-renal indication of dialysis, which is intoxication. The fastest and the surest way to get rid of any toxic medication is by dialysis, only for these medications that are dialysable, like toxicity with salicylates, lithium, magnesium containing laxatives, ethylene glycol. What's the best way to get rid of all these toxins? Dialysis. Also, the I could refer to infections related to uremia. The O, what's the O? Overload of fluid. When you have too much fluid retained in your body, and these fluids are not responsive to diuretics, this is an indication for dialysis. Finally, the U is uremia. The uremia complications, pericarditis, bleeding, and infections, these are the indications for dialysis.